All Communications provides equal opportunities for all legally qualified political candidates in accordance with FCC regulations. If you are a candidate for public office and would like to request equal time regarding content that has aired, please contact our station directly. We will be happy to work with you to schedule appropriate airtime. For more information, please reach out to the station office. 860-456-1111.
Let's talk about it. Each Friday at this time, host Dennis O'Brien and Susan Johnson interview guests who are involved in their community. The show challenges conventional thoughts, probes for answers, remembers the past, imagines the future, and gets to the heart of the matter. Let's Talk About It is brought to you by Columbia Ford Kia, Route 6 in Columbia, Connecticut, and Gates GMC Nissan, Route 66, the Boston Post Road, North Windham, USA. Opinions expressed do not necessarily reflect those of WILI staff, management, or sponsors. Now, let's join our hosts with their guests and let's talk about it.
Hey, good evening, everyone, and welcome to another edition of Let's Talk About It. And have we got a fabulous show for you this evening? This is Susan Johnson. I'm here with my co-host, Dennis O'Brien, and we are so honored to have Avery Lenhart here, who has been amazing at helping the people here who need the most help, the people who are homeless. And she has created a wonderful place for people called the Hope Project. Is that correct?
Project Hope.
Project Hope.
Yep.
Got it backwards. Okay, very good. Well, welcome to the show, Avery. Thank you so much for your amazing work. And we know at the Capitol, and one of the things we talk about regularly is that we have a crisis in making housing available. We need about 110,000 units of housing now in the state. And so far, we've been very, very limited in our capacity to create housing. And so this is something that is a big, big help. And we want to make sure people have a warm place to be and feel secure and safe. And you've done amazing work in those two buildings. So tell us a little bit about that, and then we'll have Dennis say hello as well.
You're not going to let me say anything?
Oh, no, of course you
Hi,
can
Avery. Happy to have you here. I just want to say one little anecdote. Today I was posting on Facebook. Mm-hmm. I'm from New Britain. I grew up there, and I was born in 1943. Mm-hmm. And I remember as a little kid, everybody I knew worked in the factories, and we had these factories. And one of the things I wrote in my post, which is about a paragraph long, about how, it was great that everybody could find a job, everybody who was looking or was able. And at least from my standpoint as a 6-year-old or 7-year-old kid, mm-hmm. and everybody talked about it all the time. The adults. I worked here, you worked there, but the one thing that I put in the post that is relevant to tonight's show, I don't remember any talk about anybody being homeless. There were people homeless at the time. There's no question. Mm-hmm. I learned that later from history. Mm-hmm. But in places like New Britain mm-hmm. and here that had the thread and all these other factories, mm-hmm. Those places provided jobs, and that has been a real loss to our country, losing the manufacturing that we have. Mm-hmm. And I'm glad some of it is coming back. It is, but I don't think it's ever going to be, not in my lifetime, like it was. But we do have. And, Susan and I both worked in legal aid for a long time. Mm-hmm. I was there 23 years I was deputy director of the statewide program and chief litigator. Mm-hmm. And I'll tell you, when I started in legal services, I don't remember people coming to us about homelessness. There were homeless people, and I started in 1972. Mm-hmm. But wow, it has really become, a fact of life. And it's been that way for a while. And I know there's been all talk about, groups that want to end homelessness and stuff, but wow, that's a heavy lift.
It is.
And you are right there in the middle of the situation, doing all you can with help from your friends like Bruce.
Bruce John, yeah.
Bruce John, and of course his old friend
Lefty
David Lefty Foster. and you've got a new place opening. You got a couple buildings over there on Valley Street. One is being renovated now, and another one will be renovated next year, I think.
Shortly. Well, actually, yeah. So the building at 433 Valley Street, the big building that's been under renovation now for about a year and a half, will be opening very soon, and we're down to counting days. We don't have a date yet. We have to get our certificate of occupancy. Right now, they're fine-tuning everything that's in there and making sure that everything that in there works right, and that all the doors and locks and everything in there is working nicely, so that when we move in, we aren't going to have any problems. And as soon as we move in there, they will start the work on the building next door at 459 Valley Street, and that will become our administrative offices. And so we'll have our case management and our outreach and housing location services in there. We'll also have a clinical care room, and we've been talking with Hartford Healthcare, the hospital, and Generations about having a professional clinician person come in and work in that clinical care room to do, basic healthcare things to help people not use the emergency room for their primary care. So this will be, people can go there and get maybe diabetes checks or COVID testing or COVID shots or flu vaccines or help with their medications or something like that. They just need to talk to a health professional. There will be someone there for them. We'll also have a resource room there that has computers, and I'm hoping to staff that with volunteers from the colleges. And we will have guests will be able to go there and look for housing and look for jobs and get some help with that if they need it, and things that you need to do on a computer on a daily basis as part of your life now. Sometimes, there might be a problem with their food stamps, and they want you to work do that online, fix that online. So, and that's a challenge. I'll tell you, I've helped people do that.
Yeah, it's a challenge for me, and I'm not the best with computers, not having grown up with them. But I'm it's not bad. But I hate going online and trying to get something straightened out.
Yeah.
Well, I don't know. We've been having computers at legal services, legal aid since mid-1980s. So it's not but the problem with all that is that the software changes all the time.
Yeah.
And the computers change. And now they change, and they don't even tell you they're changing the software. So it's a real problem in terms of making adjustments. So it's one of those things that we really, but I'm wondering too, I mean, there probably are people that are homeless here that would be able to volunteer to help as well.
Sure. And the other thing is one of the things that we do is if somebody who's been with us gets housed and they've been stably housed for some time and they're managing their housing well and things are going well for them, we actually can hire them back. And we have a number of staff now that are former guests of the shelter. Sure. And I love that we can do that because it's a great job. And it's not a job that's for everybody, but it's a really good foot in the door job that they can come in and get some work experience and get some good income and get some references, and then if they need to, they can move on to another job from there.
And that's such an important aspect because, as you know, I'm sure, with the changes in the big bill that's coming down with the Medicaid and these SNAP benefit changes, there are work requirements for the SNAP benefits and also for the Medicaid benefits, of which probably many of the people who are in the shelter may qualify for those benefits because their income is low enough to put themselves in a situation where they're homeless. They probably also have people who are working there and living in the shelter.
Absolutely. And Dennis, you just touched on that a few minutes ago. How it used to be that people could get jobs, that there were jobs available in the factories.
With unions.
The thing that's so interesting about that is that those jobs paid a living wage.
Yes.
And people could know that if they work in these jobs and they work full time, they would be able to afford their housing, they would be able to afford their medical care, they would be able to afford their basic needs and raise their families under, often with just one income.
I experienced it.
And now even two incomes is not enough. So we have people who are actually experiencing homelessness who are working and sometimes working full time, but they still can't afford, for instance, a one-bedroom apartment.
Right.
And it's a big problem. So we also have a number of people who are whose income is from Social Security, disability, or supplemental income. And that does not give them enough money to be able to afford even a shared unit. So what we do is we encourage them to work as much as they're allowed to and maintain their benefits. And then we try to get them into a shared housing situation.
That's wonderful. That work of coordinating housing opportunities for people who are finding themselves in the dreaded position of being homeless without shelter is a really very, very important aspect of what you do.
Mm-hmm. Yes.
And so one of the things, too, that we'll be looking at in the legislature is how are we going to be able to track who's volunteering, because it's either working or volunteering is going to be one of the requirements for the people who are going to continue on Medicaid, for example. One of the big problems we have, we're foreseeing, is the fact that instead of once a year, people now are going to have to apply every 6 months, which doubles the amount of work that the state has to deal with. The other big problem that we're going to be faced with is the fact that the SNAP benefits are also known as food stamps. The administration of that program, 75% of that cost is going to be shifted to the state of Connecticut and to all the states. So that cost that used to be a federally paid, totally paid by the feds, is now going to be shifted to the states.
Okay.
And the final thing about some of this is the fact that we're going to have a problem with error rates. Now, timing of trying to figure out the volunteers or the work of people who are in those kinds of jobs, they're not like it used to be, like Dennis was saying, you were saying, 40-hour week in a factory. Mm-hmm. A lot of these are jobs that have fluctuations in hours. Mm-hmm. And so those hour fluctuations will create a real problem in terms of being able to report back to the federal government that the people did the work for the 80 hours a month, or they were, employed for that time. Mm-hmm. And that's all the kinds of things that are going to create a problem in terms of coverage, because as we move through these policy changes, they're going to be a real problem for states and for those towns and for the people like you who will be working really hard to make sure those people are working. 75% of the people on Medicaid in the state are working.
Right.
So, but to have to track that to that every 6 months.
Those are families with children. Well, they included in that group.
Absolutely. Well, Husky.
Always have been.
Let's just say. Let's say it right here. FTC, Let's just say right now. Husky, A, B, C, and D are Medicaid programs.
Yep.
Medicare savings program that supplements your Medicare if you're within a certain income. That's a Medicaid supplement. The Affordable Care Act is up to 400% of poverty Medicaid paid, and then the rest of it is the business subsidies that go for the businesses that provide a good health care access plan to their employees. Mm-hmm. So those are the things that are Medicaid, and that's why people may not understand when many people are talking about the cuts to the Medicaid program. It doesn't say Medicaid. I mean, when you take a look at the names of the programs all over the country, they don't say it's Medicaid. They call it Husky. I just heard
call it Husky here because of UConn, I think.
But Bernie Sanders was talking about Vermont, and I was watching the senators talk about the names of their programs, and I guess they call the program for Medicaid in Vermont Dinosaur.
That's fun.
Wow.
But it's it's quite
that's interesting.
And so people aren't going to realize that these kinds of requirements are going to be going on, and I would like to focus more on how these adjustments are going to be falling on, and perhaps some of the work you have to do.
Well, I think the health insurance industry is in a very it's really, really messed up right now. Mm-hmm. And I think that when we have these cuts, it's going to affect not just the people who are recipients of Medicaid, but it's also going to affect the hospitals and their ability to survive. Because how can, if people no longer can afford to go to the emergency room, they simply are not going to go. Or any of the care, if it's not covered by their insurance, they can't
Well, let me just say this. There's something that we call that is put into the Omnibus Reconciliation Act of 1986, which is called EMTALA, the Emergency Medical Labor and Delivery Act. And what it does is it requires all hospitals to take people into their emergency rooms, whether they are, no matter what they are. And so the EMTALA issue is something that is right now going to put the hospitals at risk because they have to take everyone. So if you reduce and make the Medicaid and or the Affordable Care Act unavailable to people, then what will happen is they will go to the emergency room and they'll have to be treated by the hospitals in accordance with a law that was signed into law by Ronald Reagan. President Reagan signed that into law. Just want to say, President Reagan did it. And one of the good things that President Reagan did, because why? We had women having babies outside the hospital. We had people dying outside hospitals because the hospitals wouldn't let them in because they didn't have the money. That's not the case right now. Right now, EMTALA makes sure that the hospitals take everybody.
Right, but the downside of that is that they will continue to take people and treat them, but then who pays that bill? If they don't have Medicaid anymore, it's either that the hospital is going to eat it, which is not healthy for the hospital.
Right.
They won't want to.
Or people are going to go into serious medical debt and might lose other things like their homes.
Right.
You know. So
yeah, it's horrible. It's a horrible situation. We could talk about it all day and try to analyze it, but I think you know it's coming.
Yeah.
And we know it's coming because of our experience working with lower income people. And the thing I want to know is, and our listeners probably want to know, is you talked a little bit already about your the Project Hope. Can you tell us where are you at right now in terms of the project and all the details? And make a long speech now. And because if you don't, one of us will start talking about something else. So, and that includes me, of course. But what is your status right now, and what do you expect for the near future in terms of your capacity to deal with, and help the homeless of this area of this? Well, we're more concerned about because we live here in this town, but this region.
Of course. So, as I said before, we're moving into our new space pretty soon. We have in that space 10 double occupancy rooms. So people, each one has its own bathroom and shower. So people will be sharing a room with somebody else, but there's a lot more privacy, a lot more dignity. It's going to be very, very nice. It's going to be a much more pleasant experience for people. But I also don't want people to stay and overstay their welcome. I want people to come in and work on their housing. And that is our main focus. When people come in the door, we tell them right away, you are here for immediate safety, but we expect you to work on your housing with us. We will support you in that process. And so to that end, what we're going to do is actually close those rooms during the day so that people have to get up, get out of bed, and get moving. And they can walk to the soup kitchen and get something to eat. They can stay on the premises during the day if they want to. We're open. We have 2 common area rooms that are large, and they'll have tables and chairs where people can sit and talk. Again, once our offices are open next door, people will be able to come over and work on their services. Right now, they can come visit our offices at 872 Main Street, the former home of Legal Services.
We were there.
Yeah. I've actually visited her there, and they're occupying my office.
Oh, your office. I had a corner office. I was a big shot. They gave me a window on the river and in the railroad tracks.
I had a window facing the brick wall.
But I didn't care because I was just working all the time.
Yeah, me too.
Seeing clients.
I was glad to have a window.
Yeah, right. But I didn't really care about a window. I would have given it up to you if you asked me. But anyway, so that is what the near future holds.
Well, there's more.
Yes, please.
Good. Okay. Well, I said
those,
you could make a speech.
There's in the 2 common areas. There's one upstairs and one downstairs. We'll also be able to use that for overflow shelter and for drop-in services. So during the cold winter months, we'll have space where people who find themselves outside maybe unexpectedly, or maybe they're sleeping in their car but they don't have enough gas to keep the heat on during the night, they can come in and we'll have cots available. And there's also showers available out in that area, so people can take a shower if they need to. It's a great way to warm up if you're cold. We also have washers and dryers in the building, so people can do laundry and stay clean. And that's, again, a lot of what we're doing is geared toward helping people with their mental health. When you are having trouble staying clean, when you're having trouble with keeping your clothes clean, when you're having trouble with just depression, I feel like the things that are important: get out, get some fresh air, take a walk, get some food, communicate with other people, don't isolate. And so all of these things are geared toward that. But sleeping at night, they can go into a room that's almost private and have a nice, peaceful place to sleep. The other thing that we do that's really important work, and probably the bigger part of the work that we do, is we're involved with the CAN system in the state. And CAN stands for Coordinated Access Network. And that is a group of providers. Our CAN region happens to be all of eastern Connecticut, so all of New London County, Windham County, and 4 towns outside of those counties. So that includes Columbia, Coventry, Willington, and Mansfield. Yes, yeah. Willington and Mansfield.
Mansfield does have some low-income people.
They're part of our CAN, too. And that means we work with providers who are anybody who has anything to do with homeless services. So whether it could be a mental health provider, it could be a housing provider, it could be a shelter provider, it could be outreach providers. And so we coordinate with them on all of our work. And that way, we're not duplicating services, but we're also assisting people in the most fair and equitable way possible to get them from homeless to housed. We're meeting immediate needs, but we're also looking at their longer-term needs and their goals and how we're going to house them in a way that is appropriate and stable, in a way that's sustainable, so that they won't come back into homelessness. And that's one of our goals. And so we do this work in a very specific and direct way. And I just really like working with the other agencies.
Very rational way, too. Mm-hmm. I was a sort of a pioneer in dealing with homelessness when I was legal services here in Willimantic, but I had responsibilities statewide. But I was here in Willimantic, and we had a group called the Community Assistance Network, mm-hmm. CAN. Mm-hmm. That was, when you said that, I said, oh, gee, that's a spin-off. That sounds like the same acronym. Mm-hmm. Acronym? Yeah. Yep. Yeah. And we had Hannah Clemens, who was a former first selectman, and Irene Glasser, who was a professor at Eastern, and myself. We started it. Sister Peter came from St. Joseph's, mm-hmm. and that's how the shelter, that's how they had that building over there. And Sister Peter says, I'm going to go over there and see if we can use that building for a shelter. And that's how the shelter was born. This is back in it had to be the 80s or the late 70s. It was a long time ago.
It was the 80s because it was due to Reagan. But anyway.
Hey, stop! Wait a minute. I'm not done yet. I'm almost done. Okay.
All right.
And but we were pioneers, but we were doing it in a much less sophisticated way. Mm-hmm. And, because I tell you, I didn't see a lot of homelessness in the first 7 or 8 years that I was in legal aid. Starting in I started here as a law student in 1969, and everything was so much less expensive. That's another thing that has made a big difference. I mean, it was cheap to go to UConn. I went to UConn. I hardly had to pay anything. Mm-hmm. But everything was so different. And the one thing, Hannah came up with this great idea of having a security deposit program. So we raised money, and we would give people security deposits just to get them into housing.
Yep.
But that was something that we thought that was pretty sophisticated. But what you're doing, what you're doing with your system, the way you described it, is fascinating to me, because it's very, very modernized and much more rational and organized than what we did. And the situation requires it. It's a tough situation.
Yeah. Yeah.
Yeah, well, I'm going to ask a question, but I think we'll wait.
Oh, it's time for a break.
Yeah.
That's why you're giving me the break sign.
Yeah.
This is the break sign.
No.
You were giving me the hurry up sign.
That too.
Come on,
hurry up. We're going on a break.
All right, this happens.
Hurry up. Yeah, it's a little joke.
It's not easy hosting a show with another person, but we somehow manage.
A couple of control freaks.
Right, huh, Matt? All right.
He has
All
a
right,
good
Susan,
time.
do what you want.
All right. This is Susan Johnson. I'm here with my co-host, Dennis O'Brien, and have we got a great guest for you, but we will be right back after these messages.
This is Dennis O'Brien, and we are talking about Project Hope on the radio, and we're trying to introduce the, I don't know if you've been on the radio talking about this before.
Yeah, she has.
I have.
With Wayne Norman?
I've done Wayne Norman and you, and...
Yeah, she was here before.
Yep.
Yeah, yeah.
With me?
No, you weren't there.
I wasn't there.
Yeah,
where was I?
You were out doing good work.
I was out doing good work elsewhere in the community. That's what I do.
Yeah, well, I just wanted to go and talk a little bit about the age groups, because my understanding is in the last couple of years at the Capitol, I'm hearing here and at the Capitol that we have a lot more in the way of senior citizens who may go into the hospital, spend time in a nursing home, and then come out and not have any place to live.
Yeah, and another thing that happens, one kind of common scenario that we have is once we had a woman who came to us because she had been with her partner in an apartment. They were in an apartment together for many, many years, but he passed away of something, natural causes, and she was unable to manage the rent by herself on her income, and it was too small a place. It was nice for the two of them as a couple, but it was too small for her to bring in a roommate. And so she ended up becoming homeless because she could no longer afford anything on her own with her limited income. And I think that we're going to see a lot more of this. And it's just, it's a very difficult situation. Recently, when I looked at the population of the shelter at that point, this was just a few weeks ago, we had 28 beds, all of them full, and 10 of those people were over the age of 60. So that's more than 1/3 of our census, and that was just appalling to me, to think that there are that many people over the age of 60 who are literally on the street homeless. Mm-hmm. And I'm glad we could bring them into the shelter, but it also really worries me.
Sure, because of capacity. Mm-hmm. Your capacity has got to be limited, and that's something that, I mean, I don't know what you're going to do. You're going to, I mean, I remember when the shelters first started appearing in Hartford and other places, and they were, my sister's place, or they were concerned. We used to have discussions in legal aid, statewide meetings of housing advocates about, gee, what are they going to do? You know, when they're overwhelmed, they're going to kick people out, and that is. I mean, you seem to have a really good plan to energize people to help themselves,
right?
To the extent that they can. And I got to tell you, from all the years I worked with low-income people, a lot of people don't. Most people do not stay in poverty forever. They're resourceful enough. They're human beings. They're energetic. They figure out a way, and if they get help, it makes it easier for them. Mm-hmm. They figure out a way to somehow survive and get housing and do whatever they have to do to have a quality of life that's decent.
Mm-hmm. Yeah, that's very true. But on the other hand, there were more resources. And when you're talking about people who are in their 60s, it's very, very hard to get a job in your 60s, especially if you're homeless. Mm-hmm. Sure. And you may have some medical conditions that will, get in the way of regular work.
Yep.
And so that's the other thing that it brings me to. One of the areas that I worked in back in the day is making sure people get their access to the Social Security Disability Program. And I'm just wondering, is legal services helping, or do we have any lawyers around who are available to help people get that Social Security disability benefit?
So there are attorneys around, but I unfortunately don't know where they are or who they are. I also know that there's I believe, a fair housing attorney at Legal Services now. We didn't have one for some time, but I recently learned that there is a new one there, and I haven't got that person's name. But so helping people with legally with applications for Social Security disability or keeping that going is really important. The other thing is there's something called SOAR training, and I cannot remember what SOAR is an acronym for, but it has to do with specifically people who are trained to help people experiencing homelessness apply for Social Security disability. And we happen to have in our CAN a SOAR specialist, and so we can make referrals to that person. The client needs to be somebody who is either experiencing homelessness or is in housing that is through the homeless services system. So, but that SOAR specialist is great because they have a much higher rate of successful outcomes with their applications.
So so you made me think of CHESS, which is the community, homeless support system that for people once they get housed, to make sure that they stay housed.
Right.
And one of the things that our commissioner wanted to do this last cycle is to eliminate CHESS because there's no housing. And both the chairs and me and a few others in the Human Services Committee said, hey, don't get rid of CHESS. It's a great program, and it helps people stay housed, especially people that have behavioral health issues or physiological issues. They are the ones who need that. So I'm just wondering, are we still able to utilize CHESS, and is that working out?
CHESS is available for support services only. If you recall, when the program first came out, it was housing too. But now they just offer support services, which is in the form of case management in most cases. But I do know that we are working with CHESS workers through, I think, TVCCA. Houses our CHESS workers, and there are a few of our clients who are working with them, and it's a great program.
It is a great program, and I'll never forget when I found out about it about 10 years ago now, and I was like, wow, this is great, we've got to do it. And then we had our former person who was a Medicaid director. She and I used to go to the Milbank Foundation meetings all over the country to talk to people, Medicaid directors all over the country. And that's where I learned about CHESS. And then she went right to work and made us have a CHESS program too. So it's a great opportunity, and I think that there are ways that we should be looking at in terms of the creation of housing, and some of the historic buildings, I think, are an opportunity for the state to step up and get those places built so that they can house people.
I agree. I think taking care of the blight, it would solve so many problems at once. Taking care of the blight, taking some of these older, kind of dilapidated properties and turning them into housing is something that's so desperately needed right now.
Absolutely. And I had a bill to try and do some of that with the councils of government in the state of Connecticut to make sure that the towns like ours, towns like Hartford, Bridgeport, Waterbury, New Haven, they can't really afford to do much except for close the place down. That's dangerous.
Right. And
if we could get work as a region to do the enforcement and then utilize, I don't know what the status of this is after the big bill, but what's going on with the community development block grant money that was and is being utilized here, say, for our housing authority, but it could also be used to restore a lot of these places or keep them from crumbling to the ground.
Right.
Well, housing is tough in Connecticut because of our structure and 169 towns, and about 10 of them, or 15 maybe, are really, willing to take everybody, house the poor. There are an awful lot of towns in Connecticut who just don't want poor people in the town. And there's no apartments. And, there's a lot of those towns are around here. And one of the things that I bemoaned when I was director of the Housing Task Force for statewide legal services, Connecticut Legal Services, was, the fact that, people would put enormous pressure on places like New Haven, Hartford, Bridgeport, Willimantic, New London, the towns that have, the toughest road to hoe in terms of achievement in school and stuff like that, and they would put pressure on the towns where legal aid was situated, and these other towns would say, well, why can't you do it? Well, what about you guys? I mean, this is something that Connecticut is constantly tried different schemes of trying to get towns that really virtually do not have apartments that are available for lower income people to do so, and it's not easy. It's not easy given our organizational structure of our towns.
I agree, and I think that it's a much more complex issue than just saying, well, let's build some apartments that are affordable.
Yep.
Because if there's no industry where people can work, then they're not going to be able to afford those apartments.
Yeah.
Or if there's no transportation to industry where people can work. And I think for Northeast Connecticut, transportation is one of the biggest problems that we have here.
Right.
And people can't get to reliably, even to get to Walmart if you're working a late night shift. How are you going to get back? Or to the areas of Danielson where they have, for instance, warehouses.
Yep.
Or FedEx is a great employer up in Wellington, but how do you get to work?
How do you get to Wellington?
How do you get to
you
Wellington?
can't get there from here.
But we get a lot of our folks apply and get offers to work there, but then they can't sustain it because they can't find rides.
Well, that's the problem that this place has that's unique. A lot of people don't realize from the policy making in Hartford that when you look at Eastern Connecticut, when you look at Wyndham is really cut off from the rest of the state because we only have Route 6 and it's a 2-lane highway.
Yes.
And you only have 32 going east, and that's 2-lane highway. And when you have the rest of the places that have a hospital and a university and all that, what do they have? They got a 4-lane highway. Mm-hmm. We do not have a 4-lane highway.
Right.
We have been isolated and kept off. And the other thing that I wanted to mention as well, and you may know more about this than, you can correct me if I'm wrong, but my understanding from the Capitol is that we only have 17 towns that have any homeless shelters in them at all. And this town has 3.
In the whole state.
Yeah, 17 towns in the whole state.
That's not good.
I didn't realize that number.
Yes.
That's pretty sad.
That's pathetic. And so we only have 17 towns that have homeless shelters. This town has 3. Mm-hmm. We are completely isolated from the rest of the state because we don't have transportation in and out of here to any great degree. Mm-hmm. And it is a real problem because we do have housing. We do have more public housing on a per capita basis than anywhere else in the state of Connecticut except for Hartford.
Yeah.
And so we do have that. And, of course, the public housing is the housing authority, and they don't pay any property tax. And then that took place under Malloy in 2015, and I've been trying to get it back for years ever since. But it is something that they should get pilot money. And
there should be pilot for,
yes.
Having worked in human services for a long time for an agency that, of course, does not pay property taxes. After I got out of there and I started working for towns, I realized how, it's not. We need to have these agencies in our town to help the low-income people. At the same time, they're hurting the town by not. They can't pay taxes. I don't expect them to pay.
No.
But there should be pilot money for them, just like they are for the university and churches and other.
Churches.
We don't get churches now. We should get pilot money for churches too. And anybody that doesn't pay taxes, the state should at least pay. We're getting 50% now here.
It just depends on what it is.
Well, yeah, it depends on what money they have available for it that they appropriate.
Well, no. There's
but we have that 3-tiered system that I helped put in.
Well, yes, but the hospital is one rate of reimbursement.
Yeah, right,
the university is another rate.
It's so
depending on what type of housing it is. A group home perhaps might get a rate as well.
Yeah.
They're all little different rates. But in terms of the cutbacks, we're the top tier. So we have so many low-income people here. We're one of the poorest. We are the poorest community actually in the whole state. So we are it.
I would argue that we're not. But
why would you argue
we're
that?
number 2 next to Hartford.
No,
because I think you have to look at social things.
you look at social things. They have a
If
rail
it's
station.
just
Let me
economics,
just say, they have
you're
a rail
probably right.
station. They have a rail station. They have 2 highways going
resources,
through.
yeah.
They have things that, and they have Aetna.
Yeah.
They have property tax base that we don't
You're
have.
making a good
Nevertheless,
point. I agree
okay.
with you.
So those are different
I think
things.
it's easier
that,
to be poor if you're living in a large city like Boston than it is if you're living in a small city like New London,
Right.
say. I really
But
do.
nevertheless, here we are. We have all these things. We had the American Thread here, international monopoly back in the day, and that is how we got this place developed. And when the property tax base left us with a huge infrastructure to support people, but we don't have the tax base to pay for it.
Yeah.
And that's a problem. And it's not recognized because everybody presumes we're like Hartford,
Yeah.
or that Hartford's worse off. Why? Because they have more poor people. Sure they do, because their
lot more.
population is like 100,000.
Yeah.
We're 24,500.
It's well over 100,000.
Okay, we're 24,500, a little bit more than that, and we have a population of 13,800 people on Medicaid,
Yeah, more than half the people in our town are on Medicaid.
and that's not
Of course,
the case in Hartford.
No.
Right.
Well, Hartford has resources. You're correct. But at least we have a, let's say, a safe.
I'm not picking on Hartford. I'm just saying.
It's a safer community. That's what I want to say.
We're a wonderful community. This is
We are.
fabulous, and we do
We're
lots
a
of great
welcoming
things.
community.
We have a huge
And
diversity
Avery Lenhart
here.
is a big part of it.
Yes,
welcoming
she is.
people.
We have amazing diversity. We have professors,
I like the
universities. We've got technical school. We've got so many things here, and we're taking
And
care
we've
of
got
the
Matt
people.
Rupar, who's coming into the room now to tell us we're almost finished.
And of course, he's interrupting me, and he always says I interrupt him.
No. Okay, I
Yeah, you did. You did.
I committed a one-shot foul.
No,
that's all.
you're just upset that I got you on the Harvard thing. Anyway,
We'll argue this over later.
all right, over dinner, huh?
No. We don't have time for dinner.
Oh yes, we do.
No, late, yeah, tonight after 9 or something.
All right, so here we are. We're on the verge here. A few more minutes. And what didn't we cover? What do you want to get?
What do you
out
want
there?
to say?
I want to make sure people know a few things. One is we are going to be having a ribbon cutting event at the end of the month on
good.
October 29th. If anybody would like to come, it's at 10:30 in the morning. That's a Wednesday. The commissioner from Department of Housing will be there, and we're inviting several other very important people. But we would love to see people come, and you'll be able to take a tour of the new facility. And we're just so excited about the changes and about having this beautiful space to call our own. I have joked quite a bit that the most beautiful building in town is going to be the homeless shelter. And I just love this because it's a beautiful space, and we're so excited about it. But I also want people to know something else. We received a very generous grant from the Department of Housing to cover these renovations, and it was important that we did that. But that money is just for the renovations. It doesn't cover our operational funding. No. So I must put a plug in here to say we still need contributions from the community. And this is one of the reasons that I love Willimantic so much, is because they do take care of their people. And we've had so much support from members of the community. And I just want people to know that we still need your support to be able to cover our operational expenses, to pay for staff, to pay our utility bills and things like that. This is all very important for us. So if you can make a contribution, I would love it if you would visit our website at projecthopeect.org or send us a check at P.O. Box 46. Thank you.
All right, yes.
To find the website, all you need to do is what I do, Project Hope. Bingo. You find it, and it's a very informative, well-done website, and you can donate right on. They have a button you can push, and that'll get you going in terms of making a donation. And it's definitely a worthy cause, and I hope people will continue to support it as you have in the past, and even to a greater extent now as we face tough times.
Thank you so much.
Yeah, absolutely. This is a really important thing to do, and we want to make sure that everybody can come and see the shelter, and we want to make sure that our housing looks good, whether it's the Housing Authority housing, the shelter housing, no matter where we go in town. We want to make sure that the resources are there for people to maintain their homes, and this is a very important aspect of this, because that way we may inspire places that don't have shelters to maybe say, hey, hey, that's a good-looking place. Maybe we could do that. And I think that is a way to, because if places don't look good, nobody's going to want to follow what we do.
True.
Right. I do think that having private space and, where you can go in and shut the door, you can feel safer, it's going to help people sleep better. I think that's really important. And, I'm excited for this model, and I hope other shelters or other people who are considering opening shelters will look at our model and because it's fairly new. It's one of the few in Connecticut that is operating in this way, and we're going to learn a lot about it, but I'm very excited.
Yeah, I am too. I think it's a wonderful thing, and it's a great way to have people get back into housing. And I know that we're looking at building more housing around here as well. And it's going to be a great opportunity. Like I say, if you need the state of Connecticut needs 100,000 units, at least, maybe 110,000 the last I looked.
Can't put them all here.
Well, no, but that would certainly expand the population here, wouldn't it?
Yes, it would. I think we'd be bursting at the seams.
Well, that's possible.
But anyway, I
maybe
think
we'd get a highway.
This is a great town. There's so many great people here, so many great institutions. We have an airport. We have all kinds of. We have State University, nice State University. We have Susan Johnson, our state representative, and we have Avery Lenhart of Project Hope, doing a great job working with the needy and helping people to get out of some difficulty and back into the mainstream.
Yes,
and
one more
wonderful.
time. How do they contribute to your Project Hope?
They can go online to our website, projecthopeect.org, which stands for Project Hope of Eastern Connecticut, or they can send a check to P.O. Box 46 in Willimantic.
And when is your grand opening?
Our ribbon cutting will be October 29th at 10:30 a.m.
All right.
Okay, that's good. I think hopefully people will attend, and I know I'm going to try because I want to see the place. I want to see what you've done, Avery, and
of course.
I'm sure you had a lot to do with developing the format and the style of the
design.
The design of the design. That's a better word of the building. So you got 1 minute left, Avery. It's all yours.
One more time.
So. So when you come and see it, I think you'll be pleased. We tried to do. There's a beautiful porch. We've got some just a lot of safety and security measures in place. There's a lot of very up-to-date technology, but it's really designed with one thing in mind: helping people live to be able to stay there in a dignified way, to have some privacy, to have some quiet, and to be able to get the help that they need to be able to move out. So it's a very exciting thing, and we're really, really looking forward to moving in there soon.
And everybody deserves to live in a dignified way. Okay, this is Dennis O'Brien with Susan Johnson, Avery Lenhart of Project Hope, and we thank you for listening, and we'll be back next week with another great show. Avery, thank you so much for joining us today on the show. We really appreciate it.
Thank you so much for having me.